Thank you all so much for having me. My name is Dr. Aviva Gaskill. I'm a clinical health psychologist. We do exist. There are therapists who actually understand medical issues and living with chronic health conditions, and I am one of them. I have a group practice just outside of Philadelphia called Seven Spoons Therapy. And I love what I do. I love working with people who live with chronic illness. Let's see. I can see people in over half of the United States. I'm a member of something called CBT-I, and so I can see people all over the country. I am full right now, but if people want to reach out to me, I'm happy to try and connect you with a provider no matter where you live. I also have a patient to thank for my being here today. Several years ago, someone came to me and taught me about EDS and hypermobility spectrum disorders. And because of that person, I am here today, and I have loved truly working with this population. My heart is full being here, so thank you. I'm going to speak with you about coping with chronic pain and chronic fatigue while living with EDS or HSDs. I could speak for hours on either of these topics, but I wanted to try and give you some snippets and some things that you could actually take home with you today and hopefully put into use. Okay, so the first things first, and I know that you are all some of the most highly educated patient population that I have worked with. So some of these things may feel like things that you already know. Just bear with me, because they may be new for some people. I want you, when you're dealing with pain or fatigue or dizziness, to really get cued in to your pain cues. I want you to try and do something before your pain gets to a level 10. Taking any kind of migraine abortive medications that you might have, lying down, eating or drinking something. I know these things seem very simple, but they're so important. And instead of pushing yourself to your limit, trying to take a step back and noticing when you are feeling that symptoms are starting to come on can be such a helpful thing. Another thing that's important is that pain changes as it moves through your body. So one of the things that we tend to tell ourselves when we're dealing with pain, and particularly chronic pain, is this is never going to end. I'm going to be in pain forever. And the way that you speak with yourself about your pain is so important, because it actually does change your mood and significantly impacts your mood, your level of depression, your level of anxiety, your level of hopelessness, your level of feeling trapped. And mindfulness is also very important. There's a million ways to do mindfulness, but I'm going to talk a little bit about some of them. One of the things that I'm sure will be spoken about later today is the question of, why do you feel so tired when you're living with EDS or hypermobility? One of the reasons is because you're not getting enough REM sleep. You can sleep, I talk to people who tell me, I could sleep for 14 hours a day and I still wake up and I feel exhausted. And it's partially because your brain is not going through enough REM cycles in the night. Now, if you live with chronic pain, that adds to disruption in sleep as well. But I want you to know it's not all in your head. And when you go to a doctor and they tell you or make it feel to you like it's all in your head, it's very important for you to understand and advocate for yourself that that's not true. I also want to say there was actually an article that came out in JAMA of April of this year that showed that when physicians have empathy for their patient's level of pain, patients actually report better pain management. And so it's very important to find physicians who are not telling you this is all in your head. That doesn't mean people like me are not important, because it's very hard to live with these conditions. But it's so important for you to feel like you're seeing a physician who truly cares about you, cares about your pain, cares about your fatigue. Okay, I'm gonna talk a little bit about pacing. Pacing is the idea that you need to take a little bit more time. I know that a lot of the folks that I work with are highly accomplished people, and having to take a step back due to pain and due to chronic fatigue is so hard. But you need to do less when you are tired. You need to watch your FOMO, your fear of missing out, because I know that can be a painful conflict, but it's so important. Taking multiple breaks throughout the day, lying down for 10 or 20 minutes, twice a day at least, again, is going to prevent the fatigue from getting worse, the pain from getting worse. And also recognizing that you can't just work and not enjoy life. I put in the quote, "All work and no play makes Jack a very dull boy." But, we have to be living life, or we will get depressed. And we will be isolated if we're not seeing friends and family. And so really making sure as best you can, and I know it is brutally hard, but trying to balance living with a chronic illness or multiple chronic illnesses, as many of you do, and trying to also enjoy using one of your spoons, if you're familiar with spoon theory, at least every day for doing something enjoyable, even if that's just for 5 minutes. Okay, so I'm going to speak a little bit with you about sleep and sleep hygiene. There's something called cognitive behavioral therapy for insomnia, CBT-I, and there are a lot of CBT-I providers throughout the country. I'm going to give you some tips that can help for some people with sleep. Getting a sound machine, if you have become sound sensitive, if you have any kind of sound sensitivity, is very important in terms of creating a really positive sleep environment. Also, using blackout curtains, real dark blackout curtains that really make your room as dark as possible. You don't want to eat too late in the evening. I know a lot of you have GERD, a lot of you have, IBS and IBDs, and so gastroparesis. And so making sure that you're not eating too late, because that can very much impact your sleep and your metabolism. If you are able to exercise, you don't want to exercise too late in the day or get your heart rate up. You want to try and finish exercising at least 2 hours before bedtime. Likewise, and I know people really don't like this when I say this to them, but you don't want to use any kind of bright screens or bright lights. No phone lights, no iPad lights, no computer lights. A reading tablet, like an e-reader, is fine, but you don't want to use anything else that has a bright light at least 2 hours before bed. And dimming it, even on a very low setting, is not going to be good enough. Your brain sees that light, it interprets it as daylight, and your brain wakes up. And so again, that can impact sleep. Again, don't shoot the messenger, because I know a lot of you survive on caffeine, but not having caffeine after noon is really helpful, because even though your body may not feel the impact and the effects of that caffeine, your brain will feel it. Likewise, no spicy foods late at night. One of the things that we say is that your bedroom is only for sleep, and one other thing that I won't say out loud because there are children in the room. But sleep, sickness, and the other thing. You want to try and go to bed and wake up at the same time each day. Again, I know that's really, really excruciatingly hard. But the sleep research shows that that is one of the best practices for getting in a good sleep routine and reminding your brain, this is when I go to bed and this is when I wake up. If you do need to nap during the day, trying not to nap for more than 40 minutes, your brain will go back into REM sleep if you sleep for more than 40 minutes. I know I just told you that you're not getting enough REM sleep at night, but again, you want your brain to be able to get into REM sleep during the nighttime hours. And so using some of these practices can really help. If you have not fallen asleep after 20 minutes, you want to get up, go into another room, and do something quiet in low light. It could be doing a few dishes or something like that. That can really help with, any kind of reminding your body, like, I only go to my bedroom when I'm tired and when it's time to sleep. And then when you feel tired again, go back into your room and try and lay down and go to bed. By the way, these are practices that we teach everybody with CBT-I. You want to cover your alarm clock. If you can see your alarm clock at night, that can be such a significant thing. My 11-year-old covered up his alarm clock a couple weeks ago, and he's sleeping so much better. He's not worried when he doesn't fall asleep because he sees the time. And finally, you want to try and do a brain dump before bed. What do I mean by a brain dump? So if you're anxious, you're having tachycardia, you want to try and fall asleep, trying to just write down anything that you might feel anxious about, just dumping it all out on a piece of paper. You don't need to be able to read it. You don't need to be able to look at it again. Just dump it out of your brain, because what happens is we cycle through these things over and over and over again, and your brain is like, this is a great time to do it. It's quiet, nobody's here, right? But it's really, your brain sort of getting anxious. And so if you can dump it out on a piece of paper, that's a really wonderful thing for your brain to be able to do and to get some rest. Okay. I want to go back. Okay. I also want to just remind people that if you have POTS or dysautonomia as well, you can get really severe vertigo. And so, nausea if you're underhydrated, if you haven't slept enough. And so that obviously adds to things. And then if you're perimenopausal or menopausal, that can further impact sleep, so much so. Okay, so some keys that I want you all to take away is, and again, I'm sure a lot of people will talk about this over the week, but you want to remain hydrated as best you can at all times with electrolytes. Eat low inflammatory foods. Exercise, particularly strength training. I know that is challenging for many of you, but you need to be able to do that safely with the guidance of a physical therapist, a physiatrist, but exercise is so important, and it will help you sleep, and it can help with managing pain, and then rest and sleep. One other thing to consider is, who do you share or communicate, who are the trusted people in your life that you talk about your pain with, that you talk about your fatigue with, that you don't share those things with? One of the things that people say to me is, I don't want to burden my family with that information. I don't want them to feel like I'm constantly depending on them for my emotional well-being. But there are times when they need to know how you are doing so they can support you and help you and love you. So having a good sense of what to communicate when, and I'm not saying share everything. I know that can be a lot for some family members. But we also know that people with strong social support networks typically do better with most chronic illnesses. That's been shown in multiple sclerosis, and it's been shown in several other diseases. So it's likely true with EDS and hypermobility spectrum disorders as well. So you need social support, and I know that's hard. I know a lot of you are isolated, but it's so important, and it's part of the reason that you're here with each other. Okay, I'm going to do a very short breathing exercise with you all. So I'll explain it first. I will demonstrate it. It's super fast and super easy, and that's why I like it. You can do it anywhere, anytime. I tell people, do it when you go to the bathroom. It's a moment when, you can just put your phone away and just breathe. It sounds silly, but I think anytime you can practice this stuff, you don't have to sit in, some sort of yogic pose and whatever. So I'm going to have you, this is the shortest breathing exercise too, which is why I love it. You're going to breathe in through your nose, pause, and then on top of that breath, take another short inhale. If you can't breathe through your nose, that's fine. Just do it through your mouth. And then you just want to breathe out long and slow. So I will demonstrate it, and then if you guys want, we can all do it together. You can practice as much as you like, and it can help you when you're having tachycardia, when you're having anxiety, when you're just having a crappy day. Okay? So if you'd all like to try that with me. Ready? So again, anywhere, anytime, you can practice that. I actually just recently spoke at a conference with a bunch of physicians in Pennsylvania, and we taught them that exercise. So if you want to reach out to me, my email address is here and phone number. I will be here this evening, but unfortunately, I probably won't be able to be here for most of the rest of the conference due to seeing patients. But thank you all so much for having me, and I'll be around the room for a while. So thank you.